now that the election is over, I can again communicate with you in mass, and that means we get to nerd out again together. You may remember in the early part in spring of 2020, we began to publish videos that we call Nerd Power to share information in real time about what's happening in Wisconsin government, what is the legislature doing, trying to explain difficult and sometimes complex issues in a way that's helpful so that you really understand the full story behind the headline that you may be reading about what the legislature or the governor is doing. And so we're back today because in the last couple of weeks there's been actually some movement on a COVID recovery legislation, and I wanted to take this opportunity to explain what is in the governor's proposal as well as what is in the new proposal, or I should say what's not in the new proposal from legislative Republicans. And so to go back, it's important just to do a little bit of a quick 1,000-foot summary. In March of 2020, we had an outbreak in Wisconsin. Like other places, the governor issued an executive order. The Safer at Home order was issued. At that point, Democrats in the legislature sent this letter to Republican leaders asking for legislative action and stating our priorities. In the middle of April, a bill was proposed, voted on, and passed, Act 185, that had a number of different proposals, some that we supported and some that were the Republicans supported. We did a video, I think, on that, and there's more information available because that's been out and published. Then shortly after that session, the Republicans filed a lawsuit against the governor and Safer at Home. In the very beginning of May, Democrats again reached out to Republican leaders stating what needed to be done on top of the initial legislation that passed. The Supreme Court later in May ruled in favor of the Republicans and reversed the Safer at Home order, diminishing the governor's power. In July, the governor issued the mask mandate, another lawsuit. In October, the governor issued an order limiting capacity in gatherings, another lawsuit. And during that time, Republicans in the legislature never proposed any legislation. They never came back into session. They didn't hold hearings on what could be done. At some point, Speaker Voss met with one of Donald Trump's COVID task force members. But again, nothing. Here's Speaker Voss at a press conference earlier in November where he admits when questioned that they didn't have any specific legislation or bill drafts.
But then he decided to put the bill out, which is every right for him to put the bill forward. We wanted to just... No, because we just wanted to talk about broad concepts. We do not have bill language drafted. We do not have bill language drafted. We do not have bill language drafted. We do not have specific provisions that we're offering like he does. But
Then in the middle of November, after the election, Governor Evers addressed the state in prime time and announced that there was legislation forthcoming. So here's the governor making that announcement.
As we've fought this virus since March, we've worked hard to support workers, families, farmers, and businesses across our state. In the coming days, I'll be announcing a package of COVID-19 legislation that should be passed quickly to make sure we have the resources ready for those who need it.
So the governor's plan, as he introduced it, the summary was 14 pages long. It took a lot of the provisions of the bill that had been passed back in April, issues around health care and health coverage for costs of tests for COVID, preventing cost sharing. It directed $63 million in additional spending right away within the Department of Health Services, within the healthcare world to address COVID. And there was $75 million immediately available for small businesses through the Wisconsin Economic Development Corporation. That legislation was introduced in the middle of November. At the time, Republicans they didn't have a counter.
We do not have bill language drafted.
And just recently this week, they've introduced their counter proposal. And that's what I want to talk about a little bit. What's different and what's missing from the Republican proposal. So the Republican proposal, the summary is 23 pages long. It's dozens of items. And there's a lot different than and a lot missing from what we passed in April. Some of the same insurance and healthcare provisions around testing are still there, and that's good. Those are very basic ideas about not allowing health insurers to charge people for COVID tests. We want to make sure people are incentivized or not punished to get tests. That's an incredibly important piece. Or that out-of-network coverages are covered, or there's no price gouging, things about prescription drugs. Those are all very basic foundational issues that we passed in April that are proposed again in this Republican bill. But there's a couple of shifts that are really difficult and things that I cannot support. The first is the Republican proposal has shifted from supporting education to punishing them. There's very clearly in this proposed legislation different ways that the Republicans have pushed school districts and school boards to go back in person, whether it's safe or not. And it really takes the form of financial punishment. So school districts that have been virtual for half the year or will be virtual for more than half the year will be required to pay the parent of each pupil $371. Now, there's no doubt that the parents probably have earned some money working with their kids on virtual instruction, but of course, there's no money from the state to the school district to make this payment. So for Milwaukee Public Schools, this would be over $25 million that our public school district would have to come up with and pay parents, and this is an unfunded mandate, which means the school district would have to make cuts and changes elsewhere. Additionally, there's a provision that under the Republican bill that requires all of the teachers to go back in person and teach from their classroom. Even if the district is virtual, the teacher has to physically be in the classroom, and if the teachers aren't physically in the classroom, they can be docked. The school district can suffer a pretty massive reduction in their funding from the state. And this is in the backdrop that school districts are not going to be held liable. They get immunity from any kind of civil wrong if anyone gets sick or hurt from COVID. So, the Republicans are pushing kids and teachers back into the classroom and taking away any kind of remedies that people may have if something goes wrong. And it's this double-edged sword that's, I think, really very problematic. We should be helping our students, helping our schools, supporting our school districts, not having this stick hanging over their head, this financial stick. The other big thing in the Republican bill that is so troubling, it's about power. There are a number of provisions in the bill that take away power from the governor and inject power of the legislature. So, for example, only staff and employees of the state of Wisconsin in the executive branch must physically go back and work from their office by the end of January unless there's a medical exception. But that doesn't apply to the legislative branch or the judicial branch. So the Republicans want Tony Evers' people to go back and to work from their office and not from home, but they're not applying that same rule to themselves. The second big issue is that the Republicans will now under their proposal, require that they sign off on the expenditure of any federal money that Wisconsin receives related to COVID-19. That the governor, when Wisconsin receives money, will have to go to the Joint Committee on Finance, which Republicans control 12-4, and they must that the Republicans on Joint Finance could then modify the plan, and the governor would not have any kind of veto power or anything. He would be forced then to execute the plan as modified. This is a massive departure from how we've operated in 2020, where the governor was in charge of and managed the CARES Act funding, about $2 billion of federal funding that has gone to every corner of the state. Thank God Republicans didn't add this provision previously. We would have objected to it. What this does is it slows everything down. Obviously, it injects partisanship into our recovery and how we spend dollars. It tries to reduce the power of Governor Evers, but it also slows things down. Why Would we need to go and have this 14-day review process and then hearings and whatnot? We need to get this federal resources. If and when we get it, we need to spend it. We need to inject it into our economy. We need to give it to healthcare workers, frontline workers immediately, and not add bureaucratic and partisan steps to the process. The Republicans also are requiring that they approve the vaccine distribution plan before it can ever begin. Again, when we get our vaccines and they can be distributed, we want that to happen immediately, not to trigger a 14-day review process and then partisan bickering and plan oversight by Republican legislators. The legislature is not the executive branch. There are two different functions in government. The legislature, obviously, we debate bills, we write laws. The executive branch, they're the frontline people that execute the plan and they take the dollars and actually get out there and spend it. So that, if you want to be an executive, run for governor, Robin Vos, don't act like you're the mini governor as the head of the Republican caucus by putting all of this oversight and reducing the governor's power and giving yourself more. And then lastly, I mean, even some of the things that I think, Democrats could support, like grants to small businesses in the hospitality sector, the Republicans put no money behind it. And so in this provision, they say, well, we know that small businesses in the hospitality sector could use relief, but then there's no money. If it's a good idea, fund it. We need to put state resources into our economy now, not some kind of gamesmanship where we say we want to fund it, but we don't actually put money behind it. That is the antithesis of what we need right now. So what's missing from this? No mention of workers or unemployment compensation and helping frontline workers, healthcare workers, essential workers to get a raise, to get hazard pay, to have some acknowledgement that to the thousands of men and women that have kept us safe and kept us going for the last several months. There's virtually nothing in the bill about economic recovery. No talk about housing and evictions and foreclosure and getting people back to work. We need direct and immediate support. Healthcare system, healthcare workers, capacity within the healthcare system. We need direct and immediate investment as a stimulus to get our economy going again. And the Republicans' first bill in 8 months fails to do all of that. So here are some links to those summary documents. I've tried to provide some of the highlights or lowlights as I see them in the battle between these two bills. Going forward, there is likely to be back and forth. But obviously this initial effort by the Republicans is not good enough. It's not something that addresses the needs. We need to support schools, not punish them. We need to get dollars into our economy, into our healthcare system now. And we need to stop playing the partisan games over who's got power and who's got oversight. Let Tony Evers be governor. He's governor. And let the legislature be the legislature. That's why you ran for the legislature. So anyway, I'll come back with more details and more updates as there are twists and turns in this, but I wanted to get this information to you as soon as I could, as I've read these proposals side by side now. The governor's plan, substantially better than the Republicans' plan that has lots of partisan pills, poison pills inside of it, and it doesn't have the direct and immediate investment that our people in Wisconsin need right now. Thank you.